Hi, folks. My name is Josh Short. I'm the Artistic Director here at the Wilbury Theater Group. And thanks for joining us for tonight. This is The Road to Reopening, a conversation with Brandon Marshall. We're very excited to be able to have the chance to talk to Brandon about this. Reopening is something that everybody's been talking a lot about lately. Governor Raimondo announced that last weekend that things would start reopening here in Rhode Island, and in the arts community, everybody's wondering, well, what does that mean for us? When will it be safe again for people to gather and to have theater and performing arts and museums and all of that? And these activities also come with a lot of other considerations that have to be made. So as we at the Wilbury Group have been working on our plan to reopen and the steps that we'll take to ensure our audience's safety and the safety of our artists, we reached out to Brandon Marshall and we asked him if he would help us review that plan. This idea to do an interview with him actually came up from Christine Treglia. Our regulars will know her as our front of house manager. And we're so fortunate that Brandon agreed. So we hope that by doing this tonight and continuing this series over the next few weeks or months, whatever it takes, our audience feels both a little more informed about the precautions that we're taking here at the theater and a little more willing to return to join us when it's safe again. So without further ado, here's Brandon Marshall is going to join me. Hi, Brandon.
Hi, Josh. Hi, how are you?
Thanks, Brandon. So Brandon is an Associate Professor of Epidemiology at Brown University, a PhD from the University of British Columbia. He has a focus in his work on substance abuse and infectious diseases, but is also an expert advisor to Governor Raimondo on Overdose Prevention Task Force and an author or co-author of over 200 articles. Did I miss anything, Brandon?
Those are the highlights, Josh. Thanks so much.
Well, thanks for being here. Really, really appreciate it. We really, as an arts organization, we don't have a lot of access to epidemiologists. So I was really grateful to you last week and talking to me a little bit more. And I'm hoping that you'll share some of the insights that you shared with me with our audience. So can you tell me a little bit about maybe any work that you're doing right now regarding the COVID-19 crisis, or what your experience is in the current moment?
Sure. So as an epidemiologist, my job is to track epidemics. So I've been following this pandemic pretty closely. I'm advising the state on some COVID testing projects specifically. So that's probably how I've been involved most heavily at the state level. I helped design a study that's just getting rolled out now, in which the Rhode Island Department of Health will be asking 5,000 randomly selected households in Rhode Island to get tested for COVID-19. And this will give the state critical information on how many people have been exposed to the virus, how many have been exposed and infected but had no symptoms, what transmission looks like in households, many other important pieces of information that will help the governor make informed decisions around when it's best to go along that pathway to reopening. So it's been, an all hands on deck effort diving into this. Everyone in the public health community and epidemiologists, all of us are looking at this very closely and doing what we can to help out to make sure that we're all as safe as possible and moving in the right direction.
Thanks, Brandon. So can you just recap for anybody that maybe hasn't been watching the news for the last few months? What is so dangerous about it? Because this, the flu kills more people, all of this chit chat, all this talk. Can you just explain to us why this is such a concern, why we have to be on lockdown right now?
Yeah, so COVID-19 is a respiratory disease caused by coronavirus, which is a type of virus that causes lots of other diseases. It's actually causes the common cold. This particular coronavirus is much more severe. It's similar in some ways to the virus that causes SARS, which was a big problem in 2003. The most common symptoms that you might get if you are infected with COVID is fever, shortness of breath, fatigue, and cough. The majority of symptoms are actually minor or present with mild symptoms, but about 10% can be very severe and require hospitalization, intubation, which is when they put a ventilator in to support breathing, and as we've seen, can result in a lot of death as well. One thing to know is that the time between being exposed to the virus and first having symptoms in most people is around 5 days, which is pretty typical for these kinds of viruses. But that can actually take up to 14 days in some people, which is why we have those 2-week quarantines in place for folks coming into the state or have been exposed and are worried that they might expose others. So that's an important measure that we wanted to understand right away when we first started to see outbreaks in China, was how long it takes between exposure and symptoms, and that drives some of the policies that we now see in place.
So these policies that we're seeing, in your opinion, how are we doing in mediating? How is the governor doing? I mean, what's your opinion on how the state is reacting to this pandemic?
Yeah, I think the state's efforts in a lot of ways have been nothing short of Herculean. I'm very fortunate to work with many colleagues at the Rhode Island Department of Health and other state agencies, predominantly on overdose before COVID was such a problem. And I see them now working 12 hours a day, 7 days a week. Many of them have not had a day off in 2 months, all to keep Rhode Islanders safe. There's literally an army standing behind that governor of state employees who are helping every day to provide her with the best possible evidence and data and information to make the best policy decisions for Rhode Island. So it's an incredibly challenging environment right now, but overall, I've been incredibly impressed by the response at a state level. We're very fortunate to have a governor who's a Rhodes Scholar, is really on top of it, knows her stuff, and listens to the experts and is making decisions with that information in front of her. So I think here in Rhode Island, we should be very proud of the efforts that we're seeing at a state level and should all feel a little bit more comforted that we have had such a robust response.
That's good. So, I mean, that's nice to hear from you. I mean, from where I sit, it looks like Governor Raimondo's killing it. But yeah, it's great to hear that from you too. So what is this? What is the most important information? Every day, there's a press conference, and we hear about the number of people tested, and we hear about, the number of people infected, and what are decisions being based on? Because of course, the more we test, the more we're going to find people are infected. So can you explain to me how these decisions are made and what we should be paying attention to?
Great questions, Josh. So I would say one of the two most important pieces that you want to look at is testing and then also hospitalizations. So testing is absolutely critical because without lots and lots of testing, we won't know how many people are infected, who should self-isolate or be quarantined. It will really give us no idea how big the problem is and how we should respond. So testing is imperative, and that's why you hear it so much in the news. Rhode Island has the highest per capita rate of testing in the nation. We test between 2,000 and 3,000 people a day right now. In neighboring states, Connecticut, Massachusetts, they test less than half that on a per capita basis. So we are crushing it when it comes to testing. And the goal that the governor has set is to test 10,000 people per day by July, which would really put us in a good place to stay on top of the epidemic so that we know when spikes may be happening or outbreaks may be popping up in different places. We've got to do a lot of testing to know that. So when you look at daily statistics, I encourage folks to pay attention to the proportion or the fraction of tests that are coming up positive. The absolute number of cases that you see reported per day is going to bounce around a lot because, as you said, that's driven by how many people you test per day, which does vary. It does tend to drop on the weekends and goes up during the week. So that's why you typically see the number of positive cases drop on the weekend. So that fraction is really important. At the early days, we were seeing about 25% of those tests come up positive every day. That's way too many. That means that we're not doing nearly enough testing. Now, our positivity rate is around 8%, which is actually below the World Health Organization guideline of 10% for when jurisdictions should consider lifting stay-at-home orders. So that's one reason why we in Rhode Island are starting to see the governor lift more of these restrictive orders, because we're one of the few states that have hit that very important measure around testing. Hospitalization is important more from a healthcare infrastructure level. We want to make sure that there's not a surge into hospitals that overwhelm our healthcare system and put us in really bad shape. So we've seen hospitalizations go down in Rhode Island for almost 2 weeks now, day after day. So that's a really good sign. That means that our hospitals are not overloaded and they're able to handle the number of people that really need that intense support clinically. So that's another really good sign, which is another reason why we're seeing some of these orders be lifted.
And the hospital workers, nurses, doctors, everyone who's part of the medical community has just been, I'm sure, just been working so hard on all of this. I mean, we keep seeing all these stories about, people going in, pulling overtime, all this stuff. I mean, it's really amazing the way everybody's pulled together. Do you feel like now, based on this information, that's starting to reopen, the way things have been? Some state parks have been reopened, conversations about reopening some outdoor dining starting in a few days on the 18th. Does all of that seem, feel good to you, or how are you feeling?
I think so, because of those reasons. We have a lot of testing and our hospitalizations are going down. I think we're in a place to cautiously and slowly lift some of these measures and work our way back to normal. What I would say, though, is that we want to move really slowly because of what I mentioned earlier. It takes about, on average, 5 days between exposure and symptoms. So, last weekend, the stay-at-home order was lifted. It was Mother's Day. People were getting together to, celebrate their moms.
Yeah.
We won't know if that's going to lead to a spike in cases probably until this weekend. So there's a little bit of delay between activity and a spike in cases. So we want to move really slowly to make sure we don't get too far ahead of ourselves, right? So if there is a spike in case counts and the proportion of tests that are coming up positive this weekend, that's going to be alarming and suggest that maybe we need to roll back a little bit. So I know that the state is treating this very cautiously, and there's a lot of people looking at these data, every hour of every day to make sure that we do this the right way.
So what activities or what things are acceptable right now? I mean, the 6 foot social distance rule, masks in public. Can you tell me a little bit about is that really okay? 6 feet, that's the magic number. I mean, I won't catch it if I'm 6 feet away from you. Can you just explain that to me?
Yeah, so COVID-19, like other respiratory diseases, is spread in 2 ways, what epidemiologists call direct and indirect contact. So direct contact is when someone sneezes or coughs and you inhale those droplets that come out of that person's mouth or nose. A typical sneeze produces 40,000 droplets, so that's a lot. And typically the droplets can stay in the air, but they typically fall out of the air within around 3 to 6 feet tends to be the maximum. So that's why there's that 6 feet rule and that social distancing is so important. Because those droplets, those infected droplets that come out when someone coughs or sneezes or sings, so that's something we can maybe get back to later, you want to be outside of that 6 foot radius in case someone does that and they're infected. The other way COVID is transmitted is indirect. That's if someone contaminates an inanimate object like a cell phone or a menu or a theater ticket. So if they have those droplets on their hands, say they touch their mouth or nose or have coughed into their hand and then touch that ticket, the virus can actually survive for hours on those inanimate objects. And then if you touch that, you yourself can become infected. So that's why hand washing is so important, is because that cuts down on the risk that you're going to infect all of these objects that we're touching in our day-to-day basis.
So is it a matter of hours that the virus will live on something like a theater ticket or a seat or something like that? Or is it days? I think the last thing I read was, it could survive up to 72 hours or something like that. I know this is changing. What's the latest?
That would be the maximum, I would say. So studies are looking at this and the information is evolving, but 72 hours is probably the maximum that virus could survive on a surface. Typically, 6 to 24 hours, I would say, is where that risk starts to come down, right? After 72 hours, those droplets have dried up and the virus is probably dead. So that's, again, where we see a lot of cleaning as well, cleaning surfaces, et cetera, to cut down on that risk.
So we're avoiding all these close gathered assemblies of people where people might be coughing and sneezing on things and touching each other and that sort of thing, which makes theater impossible to produce right now, the way that we've known it. In terms of, maybe not even theater specifically, but in terms of assembly, churches, whatever, what is so dangerous? Can you just state the obvious for me? Like, what are we so afraid of is going to happen in those environments?
Yeah. So this is what's so challenging, Josh, is that traditional seating density in theaters, right? When I go to a Wilbury show, we're pretty tight together. And that's actually part of the experience. You know what I mean? Is being together in a space. And that's at odds with social distancing, right? So if someone is sitting beside you and they sneeze and you inhale those droplets, you're at risk from COVID-19. So large crowded events are going to be a problem for a long time. There are also studies that have shown that there are what are called super spreading events, which are one reason why specific areas saw such big outbreaks early, like in Massachusetts. There was a large conference where a lot of people were sort of packed into a convention center. In that setting, one person can infect dozens of people throughout that event, and then that dozens of people infects more people and it grows exponentially. So large crowded spaces are particularly challenging to contain COVID-19. So smaller events are probably going to be a lot safer, and you're going to see over the coming weeks, the governor probably slowly increase the number of people that can congregate in one place at one time for that reason.
And thank you. So it's not the number of people does it diminish the risk of getting sick if one of those people has been infected with COVID-19, or is that how that works?
And it cuts down on how quickly the virus can spread and grow. You know what I mean? Out into the population. Yeah. So if hundreds of people are packed in, you can have potentially in that 1-2 hour period, dozens of people be exposed and infected, and then they go on and infect their friends and family members, and it grows so fast and you just can't contain it. Whereas smaller settings, you might only infect 1 or 2 people, and then it's just a much slower rate of growth. And so that's what we want to aim for, is a slow rate of growth right now, flattening. We were talking a lot early on about flattening the curve, cutting down on that rate of growth. So small gatherings of people are a way to slow the rate of growth over the coming weeks.
So, and if we could just pivot for a second. So that answers for me the risk that poses to the audience. And what about the artists? The artists who are maybe, usually there's about a month of rehearsal before a show goes up, sometimes a little less, but what activities between artists, actors, stage managers, people working in dressing rooms, what are conditions in which they could be most at risk?
So great question. So the same kinds of environment, crowded conditions, dressing rooms, being close together, basically, where you can have either that direct or indirect contact take place. Someone directly sneezing or coughing on you, or having contaminated surfaces and objects around where someone then touches that and infects themselves. So that's tough because that is so common in theater, right? To be working closely in rehearsals, in dressing rooms and bathrooms. So we're going to have to do a lot of rethinking around how to do that safely. One study I saw preparing for this conversation actually found that the louder someone speaks, the more droplets that they emit, and the farther those droplets can travel. So singing or talking really loudly actually increases the risk of transmission compared to quiet speaking. So that's again a challenge for a theatrical environment where actors and artists need to speak loudly and often sing. So some of those activities are unfortunately pretty high risk for COVID transmission.
So how, with all of that in mind, here we are in phase 1 of the reopening plan. How far along do you think it will be until going to the theater or even rehearsing for a play will be reasonable again?
You know, predicting the future in this is challenging, but I think we may not be too far off from, activities that are lower risk. So, for example, being outside is a way to lower your risk. It's easier to socially distance outside than being packed into a smaller space. And the droplets that I talked about tend to drop out of the air a little bit faster outside. There's also some evidence that the virus doesn't do as well in hot and more humid environments. So when it gets warmer and we're all outside, it is true that there's less transmission than when we're crowded inside, the air is still and it's colder and less humid. So it may be possible to start doing outdoor performances, lower density performances. You and I talked earlier maybe about having drive-in performances where people are able to stay in their cars and watch a performance. So we just maybe need to rethink how to provide theater and arts to people in this sort of initial phase of reopening. Crowded large venues are going to be challenging. Those are probably months off, I would say. But different ways of thinking about performance that lower the risk, I think we can, hopefully start to see even over the coming weeks.
Well, that's encouraging for sure. Yeah, I think that you and I had some time to brainstorm the idea of outdoor performances, drive-in performances, as you mentioned, performances maybe that would be indoors where, for very, very limited audience members. I know for larger theater companies, it might not be worth it to do a production for just 20 people at a time, but for a smaller company like ours, that's very possible. So that sort of thing, kind of opening in stages almost, it sounds like. Is that?
Exactly. I think that's what we're going to see. And we're going to have to adjust our expectations and behaviors as audience members. For a long time, perhaps permanently, we'll need to get used to washing our hands maybe when we go into venues. You'll see a lot more hand sanitizer stations in public places, and we will be strongly encouraged to use those. So that probably needs to become a normal behavior, is just those kinds of things. I wanted to mention a little bit about masks, if we have the time.
Yeah,
I brought one. I got a prop with me right here.
nice.
Yeah, so this is something as well that audience members could probably be expected or even have to wear in a theatrical setting. And I want to talk a little bit about why that is. So this is a surgical mask that I wear. It just goes around the ears like that. And there's a lot of confusion around masks. So these kind of masks, what they don't do is cut down on the risk that you would be infected that much, because the droplets come in around these gaps here and here. Studies suggest that they do cut down your risk maybe partially, say by about 40 to 60%, because some of the droplets are trapped in the fabric. So it does a little bit, but it's not going to protect you that much. What it does do is if you're infected and you cough, all of the droplets are trapped in the fabric and don't spread through the air, right? And so that's why the recommendation is that we wear any kind of face covering or mask in public, because then we're not exuding those clouds of droplets that someone could walk through or be exposed to. So, I don't have the answer yet, but one near future that I can think about is that we are required to wear masks during a performance, and that might allow us, maybe to reduce that 6-foot rule potentially. I'd have to think more about what that balance is. It's not going to be no risk. It's going to be a world of some risk, and audience members will need to think about that for themselves, sort of what risk they're willing to take. But wearing masks would certainly lower the risk substantially in the kind of settings we're talking about.
I love that, Brandon, and thanks for bringing that up, because also there was some confusion at the beginning of the whole pandemic, where masks were not going to be helpful at all. Don't wear a mask. If you're wearing a mask, you'll actually increase your chances of getting it. I heard that at some point. And then everybody wear a mask. So where was it the change in thinking, what you first mentioned here, where masks are actually not super effective in stopping you from getting it, but they are extremely effective? And did we not know, I'm sorry, I'm rambling, but did we not realize that COVID-19, you could be asymptomatic, and that's where the mask switch happened? Or
that's exactly it, Josh. So I was actually one of these people. My father was on one of the cruise ships that was in Asia when this all started to happen in late January. Luckily, he was able to disembark before it went on and wasn't able to dock. But at the time, he was calling me asking what to do, and I was like, "Don't worry about a mask. It doesn't protect you that much for the reasons I described." And at the time, we thought that COVID really only was being transmitted by people who were sick, who actively had symptoms, who had a fever and were coughing. And so, in those circumstances, if you're already sick, then you're going to not be out and about. So you should just self-isolate, and that would be the most effective way to cut down on transmission. And we thought that because that's the way SARS actually worked in 2003. You were only really at risk of transmitting the virus to others if you were very sick, which put healthcare workers at a huge risk, but not as much members of the public. We learned COVID is not like that. A lot of people, in fact, maybe the majority, have mild or even no symptoms, but they can still transmit the virus to others without even knowing that they have it. So that's why, now that we know that, that's when the mask recommendation came down, because that helps you protect other people if you have COVID and you might not even know it or have very minor symptoms.
Mm-hmm.
So that is something we learned, and that is why that policy changed. I do think in the US, we were maybe a bit behind that. Like, I would have liked, in hindsight, to see the facial covering recommendation come a bit sooner when some of this evidence was emerging. But we got there, and I think the mask recommendation will continue for the foreseeable future.
That's great. Thanks for clearing that up, Brandon. So what I'm hearing is that the future theater performance, or the near future performance, it might look something like audience 6 feet apart. I'm talking about indoors. I guess outdoors is probably different standards. I mean, would the 6 feet social distancing rules apply outdoors actually, or?
To be fully safe, probably. But again, if there was mask wearing, that would certainly cut down, right, the distance issue. So I think it's ultimately going to be a balance. And again, as an epidemiologist, I can't say any of these activities have no risk. It's all about limiting the risk. And we're going to have to live in a world for a long time where a lot of the activities we engage in have some risk. And we all need to sort of measure that, you know what I mean, and understand that. So it's going to be tough, you know what I mean? But we can do things to try to limit that, like mask wearing, social distancing, etc.
Mm-hmm. Mm-hmm. So walking into a theater, you might find yourself with, sanitizer available. Probably the days of physical tickets are probably gone for a while.
Yeah.
Right? Paper programs might be gone for a while. I know a lot of theaters like ours, we'd recycle programs if people would leave them in their seats, or they'd put them in a bin, and we'd recycle them for the following night's performance, give them out to somebody else. But it sounds like, you know, that is probably not a good idea either. Is that
Right.
true?
Yeah.
And then sitting 6 feet apart and, you know, wearing masks in the audience. What about using the restrooms or intermissions? I mean, what concerns about that, you know, should we take into consideration? Is the restroom, I thought the restroom needed to be sanitized, but after every single person used it. But then somebody brought up today on a call that RISCA and the Department of Arts, Culture, Tourism put together. Well, when you go to Lowe's, nobody's sanitizing the urinal after every dude goes in there and uses it, you know? So, and I thought, well, that's a good point. Well, so what's practical? You know, what's paranoia and what actually makes sense?
So yeah, I think, you know, if people are washing their hands, so we all have to wash our hands,
Wash
then
your
the
hands.
bathroom is a pretty low risk point, right? So if people are consistently washing their hands when they're touching the knobs or the faucets, that's great. You know what I mean? And I think that greatly reduces the risk of transmission to other people, and we'll probably be able to use the facilities under those sorts of circumstances. This has actually been known for a while. This is one reason why in airports and other public venues, there's no doors to get into the bathrooms. In design and sort of architecture and building design, ideally we want to move through a bathroom touching as few things as possible. So having just, right, hallways rather than handles and doors reduces transmission, contactless faucets, no flush urinals, all of those, you know, we've seen a long time, and a big reason why they're popular is because they do reduce the risk of infectious disease transmission. So those kinds of things may or may not be feasible to implement in a short timeline. Over a longer time, we may actually see some redesign to some of these public spaces to reduce those high touch points.
Mm-hmm. And some of that might be already, as you bring up, might already be in place in some places, it sounds like, yeah.
Yeah, exactly. You know, and the other thing that you and I talked about is having, you know, ultimately with COVID, we see a huge age gradient. Typically, the disease is much more mild for younger people and much more severe for older people. By far, most of the hospitalizations and deaths are in the elderly. So our grandparents, the elderly people in our life, are at much higher risk. So we all need to protect them and do what we can to keep them safe. So one thing you and I talked about is, you know, maybe having specific nights for elderly folks or people over 65 and 70 that might be more socially distanced or spaced out than a typical night at the theater, for example. So that also would cut down on the risk of older folks getting sick and having some of those more severe complications of COVID, if we can provide a safe way for them to enjoy a night at the theater in maybe slightly more restrictive environments with social distancing and so forth. So I think that's another option on the table that companies could explore and decide whether that's right for them.
I think that's a great idea. And another thing, I mean, this is not a plug, it sounds like a plug, but, you know, subscribers to the Wilbury Group can exchange their tickets to different performances. And I think a lot of people appreciate that kind of flexibility. And I think opening up that kind of flexibility to everyone, so that if you feel like you have a cold, you don't have to worry about losing the money that you spent on a ticket to the theater. You just exchange it free of charge. And you know, anything that we can do to encourage people to stay home when they don't feel well feels like a good idea to me.
Definitely. That's a great point, Josh. You know, you can transmit COVID if you have very mild or no symptoms, but it gets a lot worse if you are actively coughing, have a fever. So definitely, if folks are sick, they should stay home. And I love that idea of being able to allow for ticket exchanges so that people don't feel like they're losing out. If they have a little tickle in their throat or a cough, they should reconsider going out into public spaces in those kinds of circumstances. And being as flexible as possible to allow that would be great.
Absolutely. It's definitely that's definitely on our list for sure. I really appreciate all your time, Brandon. This has been really informative for me. If I could just ask another one, maybe two more questions.
Yeah, for sure.
What should we be doing right now? So we're not open yet. What should theater companies be doing right now, or any performing arts organizations, to prepare? What does like a ready, when the governor says, okay, do your plays, how do we know that we're ready?
Yeah, I think it's going to be up to individual theater companies to make the decisions they feel are best for them, given sort of the types of performances they typically provide audiences, the spaces that they typically use. Theater companies that rely on large houses, as I mentioned, that's going to be really challenging. It may be more feasible for smaller companies to provide safer spaces with smaller audiences, more socially distanced audiences, and so forth. So unfortunately, there's not going to be a magic time, as I said, when it's like, okay, there's no risk, we can all go about our activity. It's going to be a slow process of going slowly and trying to introduce sort of low risk activities first. I was reading earlier that, theater's gone through a lot over the decades, right? There's been other crises before. There's been financial crises that have been tough on theaters, and it's always a time to innovate too. So companies like the Wilbury that have already been so innovative in their programming, I'm confident you'll find a way to get there doing, as you said, outdoor performances, drive-in performances, maybe performances with smaller numbers of actors or single-person shows. Might reduce the risk of transmission amongst artists. So there's all sorts of ways we can think to sort of start slowly before getting back to the point where we're going to be in the large venues with 1,000 people. That makes sense.
Definitely. Well, thanks, Brandon. I really appreciate your helping us through this process. It's been incredibly helpful. Geez, did I forget anything? Is there any other advice or words of wisdom or anything else that maybe you'd want to share with our audiences who might, be wondering when they can get back in here?
Yeah, I would say just be skeptical if you hear in the news sort of predictions around what the future holds. Anyone who pretends to know what this fall is going to look like is not speaking from a place of expertise. We just really don't know. This is a brand new virus. We do not know what it is going to look like in the long term. Most viruses exhibit some seasonality. That means they don't transmit as much in the summer and spike in the winter like influenza. We hope that happens, that we will start to see a dip in COVID cases in the summer, but we don't know. There may be less seasonality, there may be more. So that is one reason why you hear sort of people concerned about a second wave in the fall. We might see a dip in the summer that makes us perhaps overconfident. And then when the weather changes and people start spending more time indoors in colder environments, we could see a big surge again, as like what folks are calling a second wave. So we want to be prepared for that. We hope that won't happen. You know what I mean? At the end of the day, we're just going to have to wait and see, honestly, what the summer and fall holds to some degree, while at the same time being prepared, taking precautions, and doing things like wearing masks, washing our hands, and so forth. So there's things we can do to keep ourselves safe, and at the same time know that there is going to be a decent amount of uncertainty in the long term what this is going to look like. That being said, on a positive note, I would say that, this kind of thing has never in history gone on for years. Even the massive influenza pandemic in 1918 and 1919 did only exhibit sort of a couple of seasonal cycles. So eventually these things tend to die out, or we will develop a vaccine. This is not going to be our reality for years and years. We will get over this. We will find treatments. Many folks are confident that we'll develop a vaccine. So you don't have to worry about this being the rest of our life. This will, in history, be a short-term event, even though it feels really long and tough right now.
Get through it together, right?
Exactly.
Thanks, Brandon. Thank you so much for this. This is incredibly helpful. I really appreciate your help. Thanks. I know that, you offered to keep helping us put together our health and safety plan as we try to prepare for reopening eventually in the future. And I'd love to check in with you again in a few weeks, maybe do another one of these and answer any other new questions that have come up if you're open to it.
I'd love to, Josh. My husband and I are big fans of the Wilbury Theater. As you know, we go to pretty much every performance. So I was absolutely thrilled to step in and help keep the audiences and the artists safe and do everything we can to reopen, in a safe and responsible manner, but get programming back again.
You guys are great. Well, thank you. You guys are the best.
My pleasure.
Thanks, Brandon. And I should just thanks for watching, all you audience members. We can't wait to have you back. Thanks to Go Local Prov too for your support and sharing this content, getting it out. So thanks again, Brandon. Looking forward.
Thank you, Josh. Indeed. Have a nice evening.
You too. Bye.
Bye-bye.